Hi guys, my name is Casey Arbuckle. My presentation is on parents of a child with impairments. So to go over and summarize my health concerns, caregivers protect the well-being of their child. They're often overlooked, which makes it kind of hard to find detailed information about them. They're prone to physical and mental illness more than the average person, especially depression and anxiety, and they often get less sleep than the recommended amount, and stress is a major complication as well. So in the media, parents of a child with impairments are not often seen or portrayed. So this is kind of going off of people with disabilities. And when a person with disabilities is shown in the media, it's often in a negative light because they reinforce those negative stereotypes, like making the disability the most prominent aspect of the character. Storylines revolve around their relationship to their disability, and they're not showing very many other personality traits, like who the character is outside of their disability. And then it reinforces overcoming a disability to live a normal or successful life. And there are many people out there who have come to terms with their disability and have to live with their disability for their whole life and can't just overcome it, and they can still have a normal and successful life. And it can cause other people to misunderstand what having a disability is like. But the issue is getting better. 8% of family films in 2018 and 2019 featured a lead with a disability, but it is still an issue. The next slide is on family support. I actually am a pediatric home health nurse, and so I see parents of children with impairments almost every day, and I get to know them really well, and I've seen personally just how much of a huge difference it makes in their health outcomes for them to have family support. First of all, it helps them to have breaks or get breaks. It allows them to get out of the house, spend time with other family or friends, and do something they like. Maybe get their shopping done, but it helps them to get out of the house and have a life outside of caring for their child with impairments. And it provides emotional support, gives them somebody to talk to and lean on through all the hard things that they go through. And it also makes it easier in financial support to have a spouse. I work with a lot of single parents that, it's doable, they can get it done, but it makes it a lot harder when you don't have somebody to help you make the money and watch the children. And then strengthening relationships helps ease stress, knowing that they have family to help support, that they know they can rely on, and help them to not feel alone. So the role of peers is really important for parents of children with impairments, especially in that they're more prone to depression and anxiety. Having good friends can help them to avoid that, and having good friends helps to celebrate their good times and give support during bad times, prevent feelings of isolation and loneliness, increase sense of belonging and purpose, boost happiness, reduce stress, improve self-confidence, help cope with traumas, and encourage you to avoid unhealthy lifestyle habits. And then for cyclical nature, it's very circumstantial for this population. So they might pass on the disabilities through genetics, and then those kids would have kids with their same disabilities, but it just depends on the genes and then the ability to have children. Next is the legal and political system. So funding for children with disabilities, it varies at local, state, and national levels. It has gotten a lot better with the American Health Care Act of 2017 and the Affordable Care Act back in 2010. The U.S. federal government offers Medicaid, and that helps to pay for physician visits, prescriptions, hospitalizations, lab work, x-rays, and nursing home care. But the guidelines for eligibility do vary widely, and for the services and payments. It depends on your income, your living situation, and things like that. So this population is hindered at the expensive cost of healthcare, but Medicaid can oftentimes assist with those costs and maybe other insurances as well. Cultural environment, there are many factors that make this population more vulnerable. in the community, and one of them is the religious belief that God sends sickness as a punishment. Some people believe that if you are ill or you have a disease or you have a disorder, it is a punishment by God, either to the parent or to the child. And then there are stigmas on the child disability that result in social avoidance, like people don't make eye contact or avoid conversation. They might stereotype them, like assuming that they're helpless or that they can't take care of themselves. And then discrimination, they might be denied jobs or housing or other opportunities. And then talking to them in a condescending way, like coddling them or overprotecting them and making them feel like they're helpless. And then blaming, people might be blamed for their disability or accused of using their disability to gain benefits. And then internalization, people with disabilities may adopt negative beliefs about their disability and feel ashamed about it. And then targeting of hate crimes, people with disabilities are more likely to be victims of physical or sexual violence than people without disabilities. Socioeconomic status does affect health outcomes within parents of children with impairments. If you're at a lower status, it can increase your stress, which is already very prominent in this population. And it may make them need to work more and give them less ability to provide care for themselves and for their child, or, for their family as a whole. And it makes them less likely to seek health care. So it decreases sources affecting their health status. For parents of children with impairments, this is especially with mental health. They're a lot less likely to seek help for their depression or anxiety if they're at a lower socioeconomic status. And then a lower status is linked to worse health. With race and ethnicity, there are some ethnic groups that share certain versions of their genes that are passed down from common ancestors. So if a shared gene has a mutation or a disease-causing variant, the disorder may be seen more frequently within that race or ethnicity. There are many religions that include regular health promoting activities, so they might promote not smoking, not doing drugs, or consuming alcohol, which would result in lower rates of that within their population. And then prayer and belief in a higher power may regulate emotions, and that goes with meditation as well. And then religion is linked to less distress and a reduced risk of depression, and it can enhance coping skills, giving them a hope with a higher power and life after death. And then with gender, women bear a greater caregiving and parenting burden most often. They spend more time caring for family members, experience greater depression, poor well-being, and worse physical health outcomes in caregiving roles. Usually a lot of pressure falls on the woman when it comes to caregiving, and that really affects their mental health. And women experience a greater decrease in their hours of employment and job stability than men. But this is not to take men out of the picture, because I have had many patients with single dads taking care of them, and it's really cool to see them step up and do that. But most often it is the mom that has the greater caregiving burden and is in the main role of doing that. With geographical location, being located farther from a hospital or from a healthcare provider increases the likelihood of complications, especially if it's an emergent situation where they need help right away. And being farther away from the hospital or healthcare provider is also linked to increased rates of a late diagnosis. So it takes longer to figure out what the problem is. And then telehealth and telemedicine play a big role in reducing concerns if geography is a barrier, because all they have to do is, get on the computer or on their phone and they can get help right away, which is a lot quicker than having to drive if they're far away. And it increases the speed of obtaining an exam, interpreting imaging studies, and receiving post-op care. And it is the most effective, accessible, and convenient form of healthcare when insurance complies with it. Sometimes it's hard to get insurance to get on board with telehealth and telemedicine, but when they do, it makes it a lot cheaper. And then with biases for this population, some implicit biases are just preferring people that don't have a disability to people with a disability, assuming less success or education with a person that has a disability, speaking to them in a condescending way, like coddling them, like we talked about earlier, and then assuming people with one disability may have other disabilities they don't have. For example, they might think that they have a learning disorder or an intellectual disorder that they don't have. And then some explicit biases are denying jobs, housing, and other opportunities to people with disabilities, not including them in social activities, and avoiding eye contact and conversation with them. Some of these are just for people with disabilities, and then other ones include the parents as well. And then here are the references. Thanks, you guys.